Hello, my name is Rolf Halden. I'm with the Biodesign Center for Environmental Health Engineering at the Biodesign Institute at Arizona State University. And today it's my pleasure to have with me today.
I'm Lauren Withycombe Keeler from the School for the Future of Innovation and Society at Arizona State University.
Welcome, Lauren. So today we want to explore public health. I think public health is important to everyone, but maybe you have not thought much about how to measure public health and how to protect people. Lauren, do you have an idea of what the challenges might be when you want to exercise public health, improve the health of people? What do you do?
I think that's a really difficult question and a really big challenge.
She gives it right back to me, so let's see. So one approach is that we look out for sick people and treat them. But that's after the fact, right? That's not really what we want to do. So we want to get ahead of the agents that cause a threat to people. And that requires monitoring. So in our communities, we'd like to explore what types of threats there are. And there is a brand new technology out there that is actually old, but hasn't been applied for public health protection a lot. And that's what we're going to discuss in this talk. So if you look at public health, it's really driven by the health of the individuals that represent the population and by the environment that is surrounding us. And I think that makes sense, right? If you think of what types of things can threaten your health.
Well, I guess my health could be threatened by something in the air I breathe or in the water I drink or...
That's right. So there's infectious agents, there's harmful chemicals. And so we'd like to understand as public health researchers what these things are that are posing a threat and how we can cut off exposure. Sometimes we can get rid of the agent, but sometimes we can create a barrier so people don't get exposed. And that's really public health protection as an intervention and protective measure before people get sick. Now, on the slide here, you see a rather complex composite of what is a city environment. Since the year 2008, the majority of the people on this planet live in cities. And so for us public health researchers, that means we have to find out what these people are doing. You know, we have to put the finger on the pulse of this population, find out whether they're doing well, whether there's threats, whether they're sick, and then try to deal with these factors. And now, how do we do that? How do we measure the health of everyone? We know how to measure the health of one person, right? You see a doctor, but how do you do this in a city?
Well, I don't know. How do you do it?
So we found recently that there is a mechanism by which we can capture most of the threats that are present in a city. If you go back to the clinical model, we have a person who likes to find out about his or her health, and they see a doctor, and the doctor draws blood. Now the blood circulates through your body, right? And it picks up signals from everywhere. And if you think of a city, there's also something going through the city, and that is water. Sometimes it's clean water, it enters as clean water, and then becomes wastewater. But what we call wastewater is really just used water. It's not a waste. Mm-hmm. And contained in this wastewater is a lot of information that your doctor would also be interested in. But he or she is only measuring it for one person. But when we go and measure the wastewater of a city, we learn about the entire population. And that's important because all the individuals in a population dictate what the health of that population is. If you have a few people that are sick, they can spread that disease, right? But not everybody has health insurance. Not everybody is seeing a doctor when they feel sick. And so the wastewater still captures the signal of disease or the threat that is causing a disease. And so recently in public health, we have taken to measuring wastewater. Let me give you an overview of how this works. There's an acronym there in the middle with a red circle around. It says WWTP, that's the wastewater treatment plant. So in the United States, we have over 16,000 wastewater treatment plants, and they serve about 70% of the population. Some people are connected to septic systems. That means that we can theoretically have access to health information from about 70% of the entire population. And these are these are all the citizens and the visitors and maybe undocumented people in the country, as well as people with and without health insurance. So there's a treasure trove of information. And this talk here explores how we can use this information, but also how it might create issues with respect to ethics and other aspects of society. So in this graphic, you see that there on the upper left side, you see that there's the atmosphere even that's captured. So you mentioned that the breathing, right? So we have pollutants in the air. Rain can capture that and dust, and it gets deposited on the ground. The water is rushed away as runoff and then combined with domestic sewage in a number of cities in the US and creates wastewater which has stormwater in it. So we get a signal from the atmosphere, we get a signal from industry, and we get a signal from these households. And so we can go in and measure this type of information. And so what we're doing here is we are taking what is $1 trillion investment the government has made into water treatment, and we're calling it a health observatory rather than just a wastewater treatment plant. Sounds much more attractive, doesn't it? So this is what a facility looks like. It can serve between tens of thousands to even millions of people. And this is how it works. So at what we call the mouth of the wastewater treatment plant, the raw sewage is arriving. And again, it contains anonymized information that is composited, but creates an image of the health of the entire community. And this is what we are after as analytical scientists. And this science is called wastewater-based epidemiology. And we understand it as a subsection or discipline of urban metabolism metrology, our ability to measure how cities are doing. All right, so here's an example. Now, in wastewater, you can measure a lot of things. But the Europeans have been real pioneers in measuring wastewater. And they thought, what is it that we can measure in wastewater that is very difficult to assess in other ways? And they looked at illicit drugs. Nobody wants to talk about illicit drugs. If they're in your city, you don't feel good about, creating a bad image for your city. If you take drugs, you don't necessarily want to let law enforcement know. So it's very difficult to extract information on that. And they felt at the time, that's about 15 years back, that they could use wastewater as a good matrix to measure drug abuse. And they did so. And have done this now for over a decade and have collected information on the types and concentrations of drugs that are present in Europe and consumed. And here's an example of how this works. Let me walk you through. So in the beginning, we have the drugs that are provided typically on the black market. Then there are some users that pick them up, they consume the drugs, and the drugs are excreted. With the wastewater, the drugs and their metabolites are funneled to the wastewater treatment plant, and that's where the teams are having automatic samplers to take samples. And they don't take just one sample that would represent the chemistry of that very instant, right? They take continuously samples for 24 hours and create a jug with a chemistry of 24 hours of the city. And 24 hours is enough time for everyone to make a contribution, whether it's liquid or solid, and that ends up in the wastewater and is then there for us to analyze. Now there's one problem with this. The flow of water constantly changes, particularly in systems where you combine the stormwater and the domestic sewage. So we have to get rid of the water. How do we do that? We take this composite sample of anonymized biomarkers from the population and measure a concentration, right? So this is a mass per volume of liquid. And then we measure how much fluid has flown to the wastewater treatment plant. And if we divide the concentration by the flow, then the units cancel out and we lose the volume in which the chemical arrived. And all we have is a mass per person, if we know the population count, for the area we're measuring. And so we get a per capita consumption of a given drug. And there's benefits and limitations with this. So the benefit is you can do this assessment very quickly. You don't need an IRB, so you don't need an approval to do these types of measurements, because similar to solid waste, if you analyze waste that is available to a municipal treatment facility, it is not constrained in terms of analysis to any restrictions that come from privacy, because it's impossible to trace back where it comes from. So it can give us a lot of information. The drawback is that if you have one drug user who consumes a lot of drugs, if his or her urine gets mixed with that of other people, then in the end you just get one value, which is an average. And so you can't identify whether there's one really strong drug users or two right, or 3 that occasionally use them. But we get information of how much of a drug is present in a city, what types and what concentrations. And these studies are now being done around the world. And they bring up issues of what do we do with this information and so forth. And that's, I think, Lauren, where your expertise comes in. Because as you, I think, know well and study, there's ethical, legal, and social implications. So we have created here some questions that we would like to go over and maybe get your ideas too. So the first one is where to measure and where not to measure. From an ethical perspective, what is your take on this, Lauren?
So in thinking about where to measure and where not to measure, this is where issues of privacy come in. So how do you decide where you're taking your sample from, and how do you ensure that you really are anonymizing the data that's coming in? And then how do you balance that with the public health need to understand where the sources of contamination are coming from, or where a particular problem with drugs lies?
Yeah, that makes sense to me. As an engineer, I understand that the flow of sewage starts as a trickle, just like a river, and then becomes a large stream, right? And if you're at the lower end of that, then there's lots of information on lots of people, and it's impossible to track it back. But if you go up to that trickle, to that last house on the cul-de-sac, you might be able to measure the physiology of a single person residing in that house. And clearly, to me, that becomes, a human subject study, which should have very different regulatory framework than just measuring public health, just measuring air quality and other things that we routinely do. Good.
That leads to another question that's on our slides, which is who's doing the data collection? It's one thing for you as a researcher to take a look at this and be able to profile a city and understand its metabolism, as you described. But when you think about going all the way to someone's house to collect information, that could end up being a legal issue if you find something that is, say, an illicit drug, for example. So who's doing the collecting, and how do we decide who collects this data?
Yeah, that's an interesting question, and I don't think that we spend a lot of time right now looking at that. Which stakeholder would be interested in what type of data? It's mostly driven by the curiosity of us, the researchers, and we ask questions, we like to answer them, and out we're there, measuring different things. But I agree that probably the people that are getting measured, monitored, would have very different priorities than the researcher might have. And they might not worry about drugs so much, but they might worry about other things. Maybe they live in a community that has a lot of industrial plants and petro industry and refineries, and they are concerned about exposure to fossil fuel ingredients and so forth. And we could measure that conceivably also in this flow of information. So it's a good question. Where do we direct the resources that we have? Yeah. But I guess we don't have a clear answer to this. It depends on what community we are working with, right, and where the health priorities are. Let's explore another question. So, who should have access to collect the data? So, we are just back. We have analyzed for City A. We got all this information. We know now what the people eat, how many drinks on average they take every day, how much their drinking increases over the weekend, how many cigarettes they smoke, and then we look at the spectrum of illicit drugs that are present in this community, and we can measure that there's probably a fraction of a percent of drug users, of hard drug users, that might be at risk of overdose. So my question to you is, well, the default for a researcher like myself is we write it up, we get it peer-reviewed, we publish it, and we walk away. But what do the ethicists do with this data, and the social science expert that looks at this information?
Well, I think if the objective is to improve community health, you would want to think about who are those people that are utilizing public health data to improve public health. And they would certainly be people to consider, or organizations to consider having access to that. If you're partnering with a city, it's likely that the city will want access to the data that's being collected at their water treatment plants. And then I think it's worth considering if communities are being monitored through the collection of this data, that you might want to provide access to those communities in a way that they can understand it and make use of it for themselves.
Yeah. So what you're pointing out is that there's many uses and potentially many benefits, but there's probably also many pitfalls, right? That if you you let loose of all the data, and then somebody uses it for a purpose that you haven't even thought of, and I don't know what that is. Maybe it's a real estate agent who likes to draw, his or her clients into one area and not into another, and uses information on that community, to make a case that it's better to buy a home here rather than buy a home there. That certainly is not the intent of us studying public health, but I can see that there could be use and abuse of data potentially. So that it could be monetized, right, rather than serving the public good. And that's a concern. Let's take a look. There's another question. How should the data be presented? What does that mean? I mean, to me, it's clear. I mean, I collect the data, and then we show that it's sound, it's robust, the method is validated, and here are the numbers. But is this how you would present it to a community? Like give them a
usually not
scientific
right?
paper?
Yeah, send them a peer-reviewed journal article and ask them what they think. No, probably not. I mean, I think from an ethical perspective, you want to be sure that people with a lot of different educational backgrounds can understand the data that you're presenting to them, that it's done in such a way that both the significance of the data, the implications for the community are understood, as well as the uncertainty that's around it. Sometimes when you present scientific information, it seems like everything is known, and it's hard to unpack, where there might be things that are unknown in that.
Yeah, and I think the researcher also, I mean, myself as a researcher on our team, we are in this fight. On the one hand, we have to produce data that are interesting. On the other hand, we hate to see one of our studies blown out of proportion and creating this alarm, like, oh, you should be concerned about X, Y, Z. Because oftentimes what we measure is rather obvious. We know that people drink, we know that people smoke, we know that people take medication and that they occasionally, take drugs. None of this is really new. What we add is a metric, is a baseline of usage, and then we can track in the community how any given intervention, let's think of an educational intervention in a school, how that changes the baseline, maybe on a local, in a neighborhood level, and maybe for the city as a whole. So this ideally would be an outcome that we aspire to. But clearly, if we are in a school, we probably have to adopt a very different language, and I'm not sure that I'm qualified to do the best job there. So it probably is a task that we have to do with people and experts from different fields. The next question is, how does wastewater metrology, so measuring information contained in sewage, differ from other data collection efforts? How does it strike you? I mean, how is this different from somebody calling you on the phone saying, hey, I'm doing a survey on, what is it? Smoking or drinking, yeah?
Well, one of the things that I think is potentially interesting from an ethical standpoint about wastewater metrology is that instead of creating a large population scale data set from a bunch of individual samples, you begin with a population scale data set. So you don't have to necessarily worry about anonymizing the individual. The data set itself is anonymized. So that lends itself potentially to the protection of the individuals for whom the data is ostensibly collected.
Yeah. So that's certainly a strategy that we do. We always measure at a rather big pipe so that we capture a large population. The more people we capture, the more interesting it is to us. But also the risk of finding information on any, the very low level or individuals essentially is completely gone and doesn't exist in that case. Another approach that we're taking is that we try to put the information to a context, and we like to work with multiple communities. So for context, for example, if you report finding drugs, that sounds really bad. On the other hand, if you pull out national statistics, then there's no surprise. You know that people, age 20 to 30 experiment with drugs more than other age groups. And so, if you go to a location that has a younger population, you would expect that you find a profile of that behavior in the wastewater. And so we can make an assumption of what it is that we expect to find, and then how the values, the concentrations we find in wastewater, how they match or not match this average. And that gives us a feel whether we are above or below the average consumption. Another approach that we're taking is that we measure in multiple cities. And because if we measure only in one city, that city becomes, the capital of whatever it is that we're measuring,
Sure.
if it's something bad. But the truth is, we all share these, these challenges, public health challenges. So we actually work with over 200 cities in the US, over 300 worldwide. And so whenever we measure something, we find that that something also exists in other communities, and that gives people the certainty and assurance that they will not be singled out and stigmatized for a certain finding. Because ultimately, our goal is to just bring to the light health challenges in the population, and then try to work on interventions whose success we can also measure in real time using this wastewater-based epidemiology technology.
I think that the idea that stigmas might arise as a result of the collection and publishing of this data is a worthwhile consideration. And so when I think about the question, how does wastewater metrology differ from other data collection efforts, it makes me wonder, where do we need this approach? And where are existing public health data collection efforts sufficient?
Yeah, I think that's an excellent question. I see opportunities for this wastewater-based assay, particularly in places where you are you like to collect information for which there's no other source. And so I think use of illicit drugs is one that obviously has been identified before. Another one is maybe if you think of refugee camps, if you have catastrophes, we have a lot of people all of a sudden finding themselves in a new location, and we want to manage their health. So that typically we have crowding, we have a lack of resources, maybe no electricity, and poor water quality. So we want to get ahead of the exposure and find out what are the risks. Are there individuals that are sick? You don't want to bunch those together with healthy people, and that provides opportunities. So I think that's where the opportunity space is. And I can also see that if you have an underprivileged community, and then you do measurements and you reinforce that this community suffers all kinds of limitations without actually offering the community any way out, then the measurements and the resources invested in it really don't serve the stakeholders there. And I'd like to compare it to medical tests maybe, where as a patient there really is no benefit if you see a doctor and the doctor says, well, in 10 years you're going to have cancer. You're going to go home and say, well, no, I have only 10, 12 years to live, and my quality of life going to go down the hill as soon as I get diagnosed. And meanwhile you're worrying, so the next 10 years might unfold in ways that are not optimal, and you would have been better off not knowing that information. And so similarly, I think that the information we collect also has to be shared very carefully. But it's not an easy task, and it's not one that we should leave to people like myself who are curious about data. It really, we all have to rally around and find answers to that. Maybe another question here: what makes public health data useful for addressing public health issues?
So, to extend your metaphor about the city as patient and the wastewater treatment plant and the data you're collecting as doctor or diagnostician, how do we ensure, or how do we improve the usefulness of the data that we're collecting? And where are there opportunities to make sure that that data is used? One of the challenges with diagnosis and treatment of individual health issues is that we don't always take our doctor's advice.
True.
So where are there opportunities and challenges around making use of public health data?
Yeah, I think from my perspective, I have worked in public health for over 10 years now and have done monitoring even before that. It seems to me that public health, at least in the United States, is not a very attractive issue. People care a lot about their own health. They don't care so much about public health. And what's lacking is an understanding that if everyone around you is sick, your health is at risk, and you're better off if everyone's healthy. And those, understanding this gives us kind of more incentive to consider more comprehensive health insurance, and giving people access to doctors and to good treatments, because ultimately we all benefit from that. But it's obviously is a very complex issue sometimes the word public health doesn't resonate with the audience as much, and we have to relate it more on an individual kind of level. What we just measured for the community, how can it help you? How can it help me? When we ask these questions, we get much more attention. But ultimately, we really have to understand the public health of the whole environment that we are concerned about in order to protect all the people, and with that, the one individual that might ask a question about it. So, in summary, I hope you see the potential value of measuring composited health indicators in urban or rural sewage, so in composited wastewater. It is a new field. It is called wastewater-based epidemiology, and it comes under the umbrella of the population health assessment and urban metabolism metrology, so the ability to measure the health of a city. It is non-invasive, so that samples taken don't hurt anyone. We also don't need to ask for permission, but the researchers conducting this are very well aware that if they travel up a pipe too much, that they enter into a gray zone. And we have to work together with ethicists, with social science experts, as well as with legal experts, to better understand and delineate where these problematic gray areas that turn into red areas, where they are. And this is an ongoing science and an ongoing exercise, similar to our ability to clone the clinical assays that your doctor is using right now, and to apply them to city wastewater to measure the health of all the people in the city. Lauren, thanks for joining us today. It's been a great pleasure having you.
Thanks so much.
Thanks for listening.